Mel, thank you for joining me. Did you know beforehand? Have you heard of Centrix? Had you used any of their products, and did you know anything about them?
No, I didn't actually. We sort of get whatever the practices order, really. But in terms of brand, no, I hadn't heard of them before.
So obviously fluoride products to help with professional teeth cleaning, but also as a preventative measure. What kind of material did you use previously?
We were using Durafat, easily accessible from suppliers, and yeah, it was just like a tube, kind of like numbing gel, where it comes in a little tube, and it's just kept in the drawer for as and when, and then we just put it on a wax pad and apply it with a micro brush. But obviously this is slightly different because it comes in separate packaging.
Yeah. And what kind of procedure? When did you use it in the practice?
It's usually used either on checkup, or if they have hygiene appointments more regularly than their checkups, and their high caries risk, then it's usually applied then. For teenagers or kids, especially with ortho, I think it is really important to have frequent hygiene appointments. So any practice I work at, I usually recommend for teenagers with orthodontics to come every 4 months, and then as their teeth are moving and everything, because their habits tend to change when they're in school, when they're not in school. I think it's important for more frequent hygiene for them, especially while they're at a much higher risk of plaque accumulation with the orthodontics. So it's usually really frequent hygiene appointments, or at the checkup, if they're not very frequent.
And you say really frequent hygiene appointments. How often would you find yourself using fluoride application?
Usually, at the moment, I'm finding it a bit difficult including it in, just because of dentists trying to get remembering to put a prescription into the notes. But usually, if they're, say for example, they're already on a 3-monthly basis because say they're sort of borderline perio patients, then I would say, you're also high caries risk, you've got a lot of restorations, and then usually I would apply it then. But I wouldn't apply it every 3 months, because obviously it's quite strong. So I would do it every other hygiene appointments, every 6 months. And patients usually don't mind. They're usually very grateful for it because they know it's an extra protective layer for them.
What would you use? Did you use a single dose product, or did it come in a tube, a jar? How did it come?
So the Durafat usually comes in a tube, so you have to squeeze out however, like, the correct dosage for child, adult, etc.
And why did you choose Durafat? What was it about that? What are the advantages to choosing that product?
I think because it's so well known. It's well trusted, and it's easily accessible by all the suppliers as well. So if there's, especially with COVID, where they had shortages in stock a lot of the time, if you couldn't find it one place, you could always find it somewhere else. That's one thing that I find, especially with my patients, for example, if I'm recommending interdental products or something, I try and recommend something that's very accessible, because a lot of the time I'll have patients come back and say, oh yeah, I couldn't find it, so I didn't use it. And a lot of the time it's the same thing with dentists and practices. If they can't get a hold of something, they'll find an alternative. And the alternative, they end up sticking to it. So
FluoroDose is packed in a lolly tray with a brush. So when you open the package, you mix the varnish with the brush and you can use it straight away. And it takes just less than a minute to apply it. So do you find that FluoroDose saves you time?
Yeah, pretty much, because it's it's literally there, it's ready to use. You don't have to sort of faff with it. Also, you can, because there's so many different flavors, they're all packaged separately. You can, if say one surgery doesn't have something, you could literally just grab a handful and put it in your surgery, kind of like what you do with other stock. So it makes it easy to spread the stock throughout the practice as well. And a lot of the time, if it's there in the drawer and it's ready to use, you're more than likely going to pick it up more than, say, if it was, a tube and then you have to squeeze it out and then you have to, do you know what I mean? So, but I also do think I wouldn't say the actual application is time consuming. I think actually assessing how high risk a patient is more time consuming. So I think it's advisable that when they come in for a checkup, that, say for example, we're doing, I don't know, if we did like a CPD on like fluoride application, that it's something that dentists consider that they include it in their checkup, as like they would with medical history, because a lot of dentists don't actually include diet history and caries risk. They assess the caries risk based on if they've got current cavities or the amount of restorations they have, and sometimes dentists can get a bit lax.
Do you think it coming in a lolly tray package makes it easier to apply to children and maybe those patients with disabilities?
Yeah, 100%, especially where it comes in different flavours as well, because most things in dentistry taste foul. Local anaesthetic tastes horrible. Numbing gel tastes horrible. I mean, if you can make it as pleasant as possible for people who are usually nervous approaching the dental practice, it just makes your life and their life easier. So.
Yeah. So, like you mentioned, it comes in 5 different flavours. Did the patient say anything? Did they give you any feedback on that?
Yeah, they really like the flavour. The first thing they say is, when after you've applied it and you sit them up in the chair, is, "Oh, that tastes nice." I think they don't expect it to taste as nice as it does, so that's the main thing. They don't really comment on whether it's sticky or not, because they know it's treatment for the teeth and they know that it has to be kept on for half an hour, 45 minutes, no eating or drinking. So they kind of just take that in their stride, but obviously they're appreciative of the flavour, so it makes it for them to have fun.
Mel, on to the key question. Would you recommend FluoroDose to other dental professionals?
Yeah, I would. Yeah, it does make it a lot easier to apply it. It does make your life easier, definitely. The only thing I would say is, if it is something that a lot of professionals are going to use, is just to make it easily accessible. Like, for example, I know that a lot of dentists at the moment are having problems accessing a pulp liner called Ledamix, because it keeps going, discontinuing and then recontinuing, and then, oh, we're not going to do it again. And a lot of dentists are very comfortable using a product like that, and then trying to find an alternative is really hard.
Yeah.
Now, I know with fluoride application, like, the alternative isn't going to be hard, but to make it really successful, I think they would need to put it in sort of everywhere, and then obviously keep it competitive with the main competitor, which is Durafat. And then there's some practices who use a cheaper alternative, which is like, I can't remember what it's called. It also comes in a tube. It does begin with a fluoride sort of name.
Okay, right.
It was, but some people go with that as a cheaper alternative. But where they've got the evidence from the marketing they have in the US, and it's been sort of recommended by professionals over there, I think if they really sort of spread the word, I think it could be just as popular as something like Invisalign, where it's come from the US and then it's here. So I think if the marketing's right, I don't see why it wouldn't be super